Hi students, I am Dr. Badrinath, and in this video we will see the pituitary gland, pituitary hormones. Pituitary gland is having a same structure as that of the peanut, groundnut, peanut. Okay, both are same, groundnut, peanut. Okay, and this is the place exactly in your brain. You can see the peanut here. This is called as a pituitary gland. This drop-like structure, water drop-like, exactly at the where you will wear the kumkumar and all, and it is related to Brahmarandra, near to. That is a devotional touch. Okay, devotionally I am saying that. So exactly here you can see. So imagine that there is a peanut or a single peanut groundnut is there at your central place. It is a junction of these two. Okay, and color just like a pink color, just like a peanut, and weight is also less than 1 gram, nearly around 0.7. Okay, 0.7 gram, less than 1 gram, just like a peanut. And if you see the height of this pituitary gland, you can measure in the mm. Very small it is. Very small. Just like the same size as that of the peanut or groundnut. Okay. Size is also same. That's why I compared with the peanut. Okay. Size, color, height, weight, everything was exactly. So it is a peanut. This is the your syllabus as per your university pharmacology. This line we are going to be studying in this video. Anterior pituitary hormones, okay, analogues and their inhibitors. See, 2 points are here. Analogue, which are same as that of the pituitary hormones, which works similar to that of the pituitary gland. That's why it is called a analogue. Okay, that's keep in your mind. Whereas the inhibitors, name itself indicates it inhibits, it stops the pituitary hormone, it works against the pituitary hormones. So 2 points you have to keep in your mind. Wherever the two names comes, two terms comes, analogues, okay, same, it supports. Whereas the inhibitors, it against. Okay, so now that point we will see. Here you can see the borders, all borders of pituitary gland. See here, see my cursor where the your peanut is there. Here you can find the peanut. If I enlarge this, you will get this diagram. Okay, this part you will get. Main point here you have to keep in your mind is sphenoid bone. Here, so you can see this bone is called as a sphenoid bone. I mentioned here. This sphenoid bone consists of a cavity, just like a groove, like a cave. Cave, you know cave very well. Groove like structure is there. So exactly the size of the groove is same as that of the appear. So how safely the God has designed and it has kept in a cavity. Okay, inside a cave, very nicely he kept, he designed. So this point in the examination they will ask where sphenoid bone having a link with the pituitary gland, and the cavity name is called as a sella turcica. Both are yes only, easily can remember. Sella turcica, and it is a sphenoid bone, and it is having a two lobes. No, one is anterior pituitary lobe, and next one is the posterior pituitary lobe. Two lobes are here. That points you have to keep in your mind, right? I will tell you how to keep in this memory what is anterior lobe and what is a posterior lobe. I will explain in another diagram. On the top, you can see hypothalamus. Hypothalamus, very important. Hypothalamus having a direct linkage with the pituitary gland. That point is very important. Hypothalamus controls the pituitary gland itself. Okay, pituitary gland is controlled by the hypothalamus. Very important point. On the top, it is present on the top. Okay, so these are the just like India borders. You have to keep all these things in your memory. Junction parts and borders, east, west, south, north, top, bottom. What is there? Pituitary gland. Other name is called as a master gland because it controls the all remaining adrenaline glands. Very important point. Okay, that's why it is. You have to call it as a master gland. Master. It is a recent Vijay movie, and Chiranjeevi movie is also there. Master. Okay. So it is a latest film. It is a master gland, just like a master and students, how the master controls all the students. In the same fashion, this master gland controls all the remaining students' glands, like adrenaline gland, thyroid gland. Okay, all these glands will be controlled by the master gland. Master is only one always. That point you have to keep in your mind. Yeah. Here, pituitary gland is having a two lobes, just like your P is having a, if you break a P, you will get a two lobes like this. In the same passion, here also you will get a two lobes. One is anterior lobe, second is posterior lobe. See, anterior lobe means A. A always stands for first. It is a towards your eyes in front. See, front of your face having a one lobe. That lobe is called as a anterior lobe. Posterior, post backside. Okay, posterior. And here this side lobe is called as a posterior lobe. Posterior lobe. And anterior pituitary gland is highly enriched with the blood vessels. That's why here I have shown the blood vessels. You can see this blood vessels. This point is very important. They will ask in the examination which lobe is very rich with blood vessels. Anterior lobe. Posterior lobe very rich with the neurons. Blood supply is there, but very small quantity. But highly it is supplied with the neurons. You can see the neurons. That's why I have colored green color or blue color I have shown here to indicate the neurons. Whereas here red color or pink color I have shown because it is rich supply with the thing. And keep in your mind which lobe is having a highly supplied with the neuron, posterior, because your brain is present in the backside mainly, all the neurons, okay, and the spinal cord, nervous system, everything was in the backside. That way it is well connected with the, this is also backside, no, posterior gland. That's why like that you can remember very easily. Okay. And see, there is a two hormones will be secreted by the posterior pituitary gland. One is oxytocin. This point keep in your mind. Oxytocin and also ADH. What is ADH? Anti-diuretic hormone. Keep in your mind, AD is administrative office is at backside. That point you have to remember. That is a trick what you have to remember. Administrative office. O stands for office. AD stands for administrative. Administrative office is at the back side. AC is in front. ACTH. Adreno Cortico Troic Hormone, growth hormone, thyroid stimulating hormone, luteinizing hormone, follicular stimulating hormones, prolactin, PRL. All the remaining hormones are secreted by the anterior. AC is in front. Administrative office is at backside. Administrative office is very rich with the neurons. That is a electrical wiring, electrical supply. Like that you can easily remember. These are the synonyms of the anterior lobe, posterior lobe. So total pituitary gland is also called as a hypophysis. Hypophysis. Anterior pituitary gland, this gland is called as a Adeno Hypophysis. Posterior pituitary gland is called as a Neuro Hypophysis because it is well supplied with the neurons. Neuro Hypophysis. Posterior, present in the back side, is also called as a posterior pituitary. Anterior pituitary. Anterior pituitary is also having one extra name, that is a pars. P-A-R-S. Anterior. Pars anterior. And control of the anterior, this anterior pituitary, posterior pituitary glands by the hypothalamus. I have told, no, master gland itself is controlled by the hypothalamus. And keep in your mind, this point posterior lobe well supplied with the neurons. Here you can see paraventricular nucleus, which is parallel to the ventricles. You know that there are four ventricles are there in our brain. It is present parallelly to the ventricle. That's why it is called a paraventricular nucleus. And also one more, you can see the junction part, that is a supraoptic nucleus. These two are very important. Supraoptic nucleus, paraventricular nucleus, both are neurons well supplied with the posterior pituitary gland. Here you can see oxytocin and vasopressin. Vasopressin is nothing but ADH. That is also very important point. Anti-diuretic hormone is also called as okay, vasopressin. So oxytocin, vasopressin, both are synthesized in the, see here, paraventricular and supraoptic nucleus. Here the manufactured, this point is also very important, but it is released by the posterior pituitary gland, but it was synthesized. This point also is very important. Where these are synthesized, not in the posterior pituitary gland, exactly paraventricular nucleus as well as the supraoptic nucleus synthesized both hormones. Next is oxytocin and vasopressin are carried out by axonal transport down towards the down. See here how it is a down to the pituitary stalk. Oxytocin and vasopressin are released. See here, it is a released. So posterior pituitary gland releases the hormone synthesized by the paraventricular as well as the supraoptic nucleus. Okay, that is about posterior. And you can see the here anterior pituitary releasing and inhibiting the hormones are released from hypothalamic neurons. Hypothalamic neurons are controlled. Okay, pituitary portal system. Hypothalamic releasing and hypothalamic inhibiting hormones are carried down. Hypothalamic releasing hormone, that I will show you in the next slides. Okay, to the okay, like that it will be controlled. Hypothalamic releasing hormone and all. Yeah, here you can see hypothalamic releasing hormone. This is a hypothalamus hormones. And here anterior pituitary gland hormones. It is a posterior pituitary gland releasing hormone, not synthesized. Okay, anti-diuretic hormone is also called as vasopressin, oxytocin. These are administrative office at backside, posterior pituitary. And growth hormone, thyroid stimulating hormone, Adreno Cortico Troic Hormone, Follicular Stimulating Hormone, Luteinizing Hormone, Prolactin. All these are the anterior pituitary. Whereas, see, wherever stimulating hormone, stimulating word comes, blindly you can go for anterior pituitary. This point very, very important. Stimulating, wherever the stimulating comes, blindly you go for anterior pituitary. Wherever releasing hormone comes, see here releasing hormone, growth hormone, releasing hormone, not growth hormone. Growth hormone is separate. Growth hormone releasing hormone is separate. This is a growth hormone secreted by here. But students don't get confusion in the examination, especially in the competitive examination. Growth hormone is the anterior pituitary. Growth hormone releasing hormone by the hypothalamus. Growth hormone releasing inhibitory hormone. These two are the opposite. Growth hormone releasing hormone, growth hormone releasing inhibitory hormones. These two controls the growth hormone. So wherever the word comes, again here I am selling somatostatin. It is a statin. Stops. You can keep in your mind. Stops. Okay, it stops the growth hormone, releasing of growth hormone. Whereas here it is a plus indicated by the symbol plus. Whereas here it is indicated. So it promotes the release of growth hormone. Whereas a somatostatin, it inhibits the growth hormone release. And thyroid stimulating hormone, thyroid releasing hormone. Here you can see thyroid stimulating hormone, stimulating, releasing. Here also releasing. Here also Adreno Cortico Troic Hormone, Adreno Cortico Stimulating Hormone, whatever it may be. Next, gonadotropin, sex hormones, releasing hormone, releasing. And here Follicular Stimulating Hormone, FSH, Luteinizing Hormone, LH, dopamine, prolactin. Okay, this is a dopamine. And here you can see prolactin, which secretes the milk. Okay, yeah, here you can find the anterior pituitary, posterior pituitary, ADH, adreno anti-diuretic hormones, vasopressin, also called as a vasopressin, oxytocin. These two are the administrative office is at backside. And anterior pituitary growth hormone, GH, prolactin, PRL. Here you can see PRL, prolactin, growth hormone, and adreno corticotropic hormone, which is also called as a corticotropin. Name itself indicates adrenocortico or corticotropin. Thyroid stimulating hormone, TSH, you can see here, which stimulates the thyroid gland itself. And gonadotropins. These are the gonadotropins too. Luteinizing hormone, follicular stimulating hormones. Right? Yeah, first we will see anterior pituitary hormones. First one is growth hormone. See, growth hormone is very important for our growth. Okay. See, if there is a too little secretion, you will be like this. If there is a too much of growth hormone secreted, you will be like this. And it is a right amount of growth hormone is released, no, you will be like that. 6 feet height, perfect height, you will be released. Yeah, okay. You can see the growth hormone magics. Hyper secretion of the growth hormone is called as a gigantism. You can say what a gigantic personality, gigantism. So don't get confusion. Gigantism, gigantic personality, heavy personality. So it is a world tallest person with the world smallest person. World tallest person reason is hypersecretion of the growth hormone. Gigantism, gigantic personality. His name is Sultan Kosen. Okay, 8 feet, 8 feet 1 inch. His height is world tallest. And hyposecretion, very small amount of the secret. Dwarfism, dwarfism. So if you remember the gigantism, opposite word is dwarfism. He Ping Jing, Jinping, like a Jinping, China president. Name sounds like that. Ping. 2 feet, 5.37 is the height. See how he is looking towards him, tallest person like that. Okay, and one more term is there that is also very important for competitive examination. That is called acromegaly. What is this acromegaly? We know dwarfism, we know gigantism. What is acromegaly? Here, excess growth hormone after 18 years. If it is a before 18 years, gigantism occurs. After 18 years, if there is a excess of the growth hormone releasing after 18 years, it leads to acromegaly. Very important. Acromegaly. See, this is the acromegaly symptoms. Because height is already sealed now. After 18 years, bones will be sealed, all the bone ends, so that he cannot grow. 18 years is the last stop for growing the height. Okay. After 18 years, there is no grow vertically. There is grow only horizontally. You got my point? Okay. Vertical grow, no grow after 18 years because bone ends are seized. See, once bone ends are seized, then if excess amount of the growth hormone is released, okay, then what happen? Horizontal growth will be there. So how to see this person's prominent forehead? His head is prominent. So just like a frontal bossing, you can see here, just like it comes like a in front, okay, like that swelling. You can feel a swelling like that. And arthritis, large nose. See here, this fellow is having a large nose. He's also very wide, large nose. You can see my cursor here. Large hands, very large hands, and large feet. Okay, and a large tongue. See this tongue is, see how very big is there. This tongue. Growth hormone. This is due to excess of the growth hormone. Acromegaly. After 18 years. Okay, large tongue. Okay, and prognatism, that is not much important. Lips and all, you can see the features in the diagram. Yeah, here two growth hormone functions. When you come to here, there is a two important points. Again, students are getting confusion. Hypertrophy, hypertrophy stimulates the growth, increases the size of the cell. Size, not number. Number comes here. That is called a hyperplasia. Size of the cell grows. Then you can say it is a hypertrophy. This point you have to keep in your mind. In the exam, they will confuse hypertrophy, hyperplasia. Hypertrophy means, keep in your mind, very large trophy I have shown you. Single cell is growing like a trophy. Tropy here named hypertrophy, just like a trophy. Single trophy I enlarged here. Whereas a hyperplasia, number of cells. This is a keyword. Number of cells. Number of people are there in one place. Plasia. Like that you can remember very easily. Hyperplasia means number of cells in one place like that. And also hypertrophy means size is elongated. Size of the growth will be. Example here, increasing in the bone thickness. Here, increasing the bone length. Okay, like that you can. And growth hormone main important job are these 3 points: soft tissue growth, growth of the soft tissue, growth of the bone, growth of the cartilage, right? And increases the plasma free fatty acids, increases the hepatic glucose output, decreases the insulin sensitivity in muscle. Okay, is protein anabolic hormone. Growth hormone derived from somatotropin cells. The 2 points very important: somatotropin. Somatostatin stops the growth hormone, whereas a tropin increases the growth hormone. Okay, its secretion is controlled by growth hormone releasing hormone and somatostatin. Okay, insulin like growth factor, this is also very important. I will show you in the next slide. IGF, insulin like growth uh, factor. Yeah, here you can see IGF. See my cursor, insulin like growth factor. Here hypothalamus is there, anterior pituitary gland, it releasing the growth hormone. Growth hormone acts on the liver, acts on the kidney, viscera, muscle, fat, bone, and it releases the IGF, insulin like growth factor, IGF-1. This point is very important. IGF-1 is released by anterior pituitary gland. And this IGF shows on the action on the soft tissue as well as the bones, growth of this tissue. Okay, and this negative feedback mechanism is very important in adrenaline glands. See, if there is excess of IGF-1 in the blood, it controls the hypothalamus, it controls the both anterior pituitary gland also. If there is an excess of IGF, automatically it stops the releasing of growth hormone. Even growth hormone is also having an effect. Excess of growth hormone in the blood, automatically it controls the hypothalamus in order to come very less amount of growth hormone, right? So this is called a automatic feedback. That is a system. Yeah, growth hormone, analogous inhibitors, it was mentioned in your syllabus. Analogous means which supports, inhibitors means which works against. These points are very important. Somatotropin, here somatostatin stops. Octreotide, just like a octa. Keep in your mind octopus. 8 legs will be there. 8 legs. It controls the growth hormone. It inhibits the growth hormone. Octreotide, and lanreotide. These are the inhibitors. Lanreotide. Yeah, here you can see this. Somatostatin stops wherever. See, growth hormone, it is also called as growth hormone releasing inhibitory hormone, GHRIH. It inhibits the growth hormone release as well as thyroid stimulating hormone also from the anterior pituitary gland. It inhibits the release of most growth gastrointestinal hormones, reduces the gastric acid secretion, pancreatic secretion, glucagon, insulin. All these can be inhibited by somatostatin, not only growth hormone. Very, very important point. Therapeutic uses of the somatostatin. See, whenever there was a heavy personality is growing, you give somatostatin because growth hormone will be suppressed. You got my point? Since it works, somatostatin against a growth hormone, whenever there was in the body excess growth hormone, you give a somatostatin. Therapeutic uses of the somatostatin. Octreotide, it is a synthetic. This number of times it was asked. Synthetic somatostatin analog, which is a synthetic. And lanreotide, here you saw, no? Lanreotide, same. Lanreotide. Lanreotide is a much longer acting. Lanreotide is a name itself indicates longer, like that easily you can remember. Octreotide is a synthetic, longer acting inhibitor, which is in the exam they will ask you. Okay, and use it to treat the acromegaly, because acromegaly is excess growth hormone secretion, gigantism. Okay, all these factors can be you can be treated by the somatostatin. Yeah, growth hormone in excess, mainly being a pituitary hormone. Yeah, here you can see treatment of excess growth hormone, octreotide. Just now we saw octopus, synthetic somatostatin, and bromocryptin, surgical removal of gland. Okay, or pegvisomant. Okay, pegvisomant. Yeah, next is thyroid stimulating hormone. Growth hormone is over. Now, thyroid stimulating hormone is released. It is a name itself. Name is called as a thyroid stimulating hormone. Wherever stimulating comes, you think it is a master gland, pituitary gland. See here, you can see how the pituitary gland is here. It is releasing a thyroid stimulating hormone. It stimulates the thyroid gland. Thyroid gland releases the T3, T4. So if there is excess amount of T3, T4 in the blood, it will be automatically decreases the release of TSH. Like a feedback is the feedback. Okay, stimulates the secretion of thyroid hormone, growth and thyroid hormone. Diagnostic uses of the thyroid stimulating hormone in patients who have been treated surgically for thyroid carcinoma, we can be given. Next is Adreno Cortico Troic Hormone. Adrenaline glands. See here, there is a, it looks like samosa. Each samosa is on one kidney, triangle shaped samosa you can see on each kidney. This is called as adrenaline gland. Adrenal corticotropic hormone stimulates the adrenaline glands. These releases the cortisol. So cortisol release is by the adrenaline gland. Adrenaline gland is controlled by ACTH. ACTH is released by pituitary gland, anterior pituitary gland. AC is in front, anterior pituitary. Okay. Yeah. Next is follicular stimulating hormone and LH, luteinizing hormone. These are two are secreted by anterior lobe only. I have already told you. See, these two hormones will be there in the ladies mainly. In gents also there, luteinizing hormone. Yes, in gents is also there. Not follicular stimulating hormone. Luteinizing hormone, you can find some little quantity in the gents also, but mainly it is related to ladies. So how to keep in your mind luteinizing hormone, L, ladies. FSH, females, follicular stimulating hormone, females. So ladies, females, like that you can remember in easily. Estrogen, it acts on a ovary. So this ovary secretes the two hormones, estrogen, progesterone. You got my point? Estrogen, progesterone. Okay, like that you can remember. Follicular stimulating hormone, I have shown the hint also, females. Okay, stimulates the growth and development of ovaries. See, o stands for ovary, F stands for females, like that you can remember for development. And also Fe are the side by side letter, E, F, G, H. It releases the estrogen, like that you can remember. In the males, required for sperm production, a small quantity is required for the production of spermatozoa. And luteinizing hormone, here I have shown luteinizing ladies. Okay, uh, responsible for the ovulation. Corpus luteum, it is a part of uterus. Okay, corpus. Males, it stimulates the cells in the testis to secrete the testosterone. Males also it is required, but small quantity. And prolactin, lactin, name itself indicates lactin, milk. It is mainly in the females, it stimulates the breast development and milk production. After pregnancy, after delivery of a baby, this hormone will be increased. Okay, whenever you are feeding, you are getting a feeding from your mother. Okay, males involved in testicular function. Okay, posterior pituitary hormones, oxytocin. Oxytocin is synthesized in the hypothalamus and transported to the posterior pituitary. It is very important for the easy delivery. Uterus will be contracted, so baby will be come out easily, very smoothly, very smoothly baby will be come out. So that's why the doctors are giving a oxytocin injections during the delivery of a baby. Okay, so how to keep in your mind name oxygen. Whenever you born, immediately you came on the earth, you are taking oxygen. Oxygen you are taking. So that's why like that you can remember oxytocin. It makes the easy delivery. Like that you can remember very easily. It also increases the milk also. It induces the release of milk. Small amount of prolactin is main. It induces the release of milk. Whereas the prolactin. Here milk production. Prolactin is a milk production. Here it induces the release of the milk. That point is very important. Release. Production is different, release is different. Prolactin P, production. Okay, release oxytocin. Yeah, next clinical uses, some of the clinical uses of the oxytocin. Induction of labor. Labor means not workers here. Labor means delivery or pregnancy cases. Delivery cases are called as a. And vasopressin, anti-diuretic hormone. Anti-diuretic. Diuretic we know. Two times diuretic. Two times urine comes. That is called a diuretic, which increases the urine production. It is anti-diuretic hormone. Okay, it works against the anti-diuretic. It is especially it is used in the diabetes insipidus. Very important. Diabetes, not diabetes mellitus. It is a sugar. Diabetes insipidus means urine will be passed a number of times. That is called the insipidus. Okay. Yeah. So next, I will stop my videos here. Thyroid hormones we will see in the next video. Right. In my playlist, I have kept all in a subject wise. Just watch it.